right, let's talk about what you can do if you happen to lose your job, your layoff, you're fired, you decide to quit, move, whatever the case may be. I'm getting a lot of calls, a lot of messages from people throughout the country. My father was a Teamster all his life, so I've kind of connected to the long distance truck driving community there, and a lot of people are worried about the tariffs. You know, I'm sure you've seen and YouTube and TikTok and the news about the cargo ships are no longer coming in, so they're no longer needing ships, they're no longer needing trucks, and all the rest of it. So a lot of people are wondering, okay, Ed, what can I do? What can I do if everything does go south and I lose my job? What can I do in terms of Social Security? So we're going to talk about that now. There's a lot of people that were planning to say, okay, I'm going to wait till I'm full retirement age, 67. I'm going to wait till I'm 65 or 70 or whatever the case may be, and as they say, life is what happens while you're making other plans. So it looks as though life is happening, unfortunately, to a lot of people out there. So let's talk about that today. And because all of these situations are a lot based on your particular situations, we're going to do a live Q&A. This is live. If you're watching this later to recording, make sure you subscribe and like and share and all that kind of good stuff, and join me on one of my lives in the future. And someone says, happy Cinco de Mayo, everyone. Be nice. Happy Cinco de Mayo, and happy May the 4th be with you yesterday. All right, so let's go down. We'll talk about retirement, disability, Medicare, protective filing, dire need, all of it, and then we'll answer a bunch of your questions. The first part should take about 10 minutes to go through here. All right, so obviously in terms of retirement benefits, this is one of the problems with people's knowledge of Social Security. They think Social Security is retirement, disability, Social Security cards, and they don't realize all the other programs. But when Social Security talks about retirement benefits, that includes not only retirement benefits, it also includes spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. It includes survivor benefits as well. So in terms of straight retirement, spouse benefits, retirement benefits on your own record, you can start benefits as early as 62 years old. When you start benefits that early, obviously reduced. Once you start your benefits, and you continue to get those checks, then your benefits are reduced forever. So take that into consideration. When you're 62 years old, 63 years old, and you take those benefits early, Social Security reduces your benefit amount by a little bit every single month. And there's a lot of people up there that say, well, I won't be, 65 until 4 or 5 months, and so I guess I can't start. No, Social Security, you can start any month you want. It doesn't matter whether it's your birthday or not your birthday or anything like that. Every month you start your benefits early, Social Security just reduces your Social Security check a little bit early. But if you need that money, you need that money. In terms of survivor benefits, you can start your survivor benefits as early as 60 years old. Okay, so 62 for regular retirement benefits. Again, we're talking about spouse benefits, divorce spouse benefits. Retirement benefits are on your own record. If you wait until your full retirement age, you get the full benefit amount. If you can wait all the way until you're hit 70, you're going to get what's called delayed retirement credits. You get 8% on top of your full benefit amount. Okay, what about if you were pushing yourself? A lot of people out there pushing themselves, and they're working because they need their money. Now the company is shutting down or they're laying you off, and you say, well, I've actually been disabled for many, many months. I just been pushing myself unhealthily because I needed the money, and now money's coming in, so maybe I should file for disability. If that's you, you should definitely file for disability benefits. You can be any age to file for disability benefits. If your disability prevents you from working, and that disability is going to last 12 months or longer, or end in death, then you can file for disability benefits. Unfortunately, as it says up there, you need your Social Security now. With disability, that's probably not going to happen. We're talking months and months and months to get a decision on your disability, unless your disability is so unfortunately really, really severe. There are cases where people file for disability benefits and they're approved the same day. They're approved the next day. And those are for really, really terrible disabilities, stage 4 cancer, terrible car accidents, or something like that. So those people out there that are repeating that internet myth about everybody's denied disability the first time, stop repeating that. That is not correct. Your disability might have been disapproved the first time, but I've taken hundreds of thousands of disability claims, and I know that's not correct. So when people repeat these internet myths like that, then it really depresses the people that are eligible for those benefits. And they say, well, I've got so many situations. I've got my financial situation. I got my medical situation. I just can't, handle another denial like that. So I'm just not going to file because everybody's denied the first time. So we need to stop that internet myth because it's just it's hurting a lot of people. The trick, if you are going to file for disability, you can file for disability and retirement benefits at the same time. You don't get both checks, but while you're waiting for your disability to be approved, 6, 9 months or whatever the case may be, you can start receiving your retirement benefits while you're waiting. And then when they approve your disability benefits, it might be reduced based on how many months you received your retirement benefits, but that's really based on when they determine you became disabled. So a lot of people, it's called a rib-dib. You file for both at the same time, retirement benefits and disability benefits. Again, you have to be 62 to get the retirement benefits. Or if you want to file for survivor benefits, you can file for survivor benefits, and you can file for disability benefits on your own record. All right, what about Medicare? And then I'll tell you all the tricks here about the protective filing and dire need and how to make sure you get those benefits as soon as you possibly can. What about Medicare? There's a lot of people out there that were 65 years old, were working, and so they didn't sign up for Medicare, which is a very smart thing to do. If you're working, you have health insurance from your work or your spouse's work, and you're happy with it, and your employer has 20 or more employees, then you do not have to sign up for Medicare. So why waste $185? You can sign up for the Part A, which is zero premium, but you don't have to sign up for Part B and waste $185 if you don't need it. But now, let's say you're 66, 67, 68, 69 years old, and you're going to lose your health insurance from work, and you need to go ahead and sign up for Part B. You're not going to be penalized, but you have to prove that you had health insurance from current work. And there's a couple of forms you fill out. We're talking about a bureaucracy, so we're always talking about, there's always forms to fill out. But there's a couple of forms you fill out, to 40B and the 564. I'll put those links in my YouTube description there, and you just fill out those forms. One of those you take to your employer, and they fill it out, and they say, hey, yes, this person did have health insurance since they turned 65, so don't penalize them, and they'll go ahead and sign up. All right. So now the issue is getting those benefits, because Social Security was at a 50-year low in terms of staffing before DOGE was even started. And now, with thousands of Social Security employees being, voluntold to be, as we used to say in the Marine Corps, voluntold to leave the premises, it's tough to get your benefits. So if you're losing your job and you need your retirement benefits next month, it might take a month, 2 months, or 3 months to actually start it. And what are you going to do in the meantime? Well, here's the tricks. If that happens to you, then you need to go down there and, you can call the 800 number, set up an appointment, or you can go down to local office and say, hey, this is a dire need case. One of the things I would recommend is, because the reason, you're not able to get customer service is because politicians refuse to support Social Security, refusing to support customer service for people to help you get your Social Security. So if you do what's called a congressional, so if you lose your job or something like that, you immediately reach out to one of your 2 senators, or both of them, or your congressperson, the House of Representatives, your federal one, and you go onto their website, and they all have a little link on the website that says, I need help with a federal agency, or you call them up. And as soon as you do that, the issue becomes a congressional issue. So when you go down to your local Social Security office, you tell the Guard, and the Guard is not a Social Security employee. They work for what's called Federal Protective Services. They're a contracted company, that guards the facility. And so they don't really know. But you tell them this is a dire need, this is a congressional issue, and policy dictates that you need to be seen immediately. So please only do this if you actually need the money, if immediately. If you can wait a month or 2 months or something like that, just unfortunately go through the whole process. It shouldn't take that long. Reach out to your politicians anyway, but don't use that kind of card to get in, because there are other people that might really need to get their retirement benefits or get their Medicare started immediately. So please kind of defer to those people that actually need those benefits. So if you're able to wait a little bit, please go through the regular process. You can file online. Even filing online, someone on the other side needs to look at that claim. So even filing online, it still might take you a month or 2 months or 3 months to get those benefits, because a human being actually has to look at your claim, reach out to you, make sure everything is correct. So if it is a true dire need, let's leave, that kind of first place in the priority line to those people that actually need it. Okay, so let's say you're doing this because your boss said, hey, we need to let you go and you need that money. And you're saying, well, your boss said, okay, but we might bring you back in a month or 2 months or 3 months or 4 months from now. And you're saying, well, that's all fine and dandy, but what am I going to do for those 2 or 3 or 4 months? You can change your mind. You can change your mind. So if situations change, let's say you go ahead and file for retirement benefits and you start receiving those retirement benefits, or you go ahead and sign up for Medicare and you start receiving that Medicare, you start paying the $185, and then they call you back to work or you find another job. You can take a mulligan. You can redo. If in terms of money, retirement benefits, within 12 months of your first check, you can completely withdraw your application. So you can say, hey, I thought I was going to need this money. I really wanted to wait to my full retirement age, but I started at 63 because I really thought I was going to need this money, but I just got another job. So within 12 months, you can withdraw your original application, and then you have to pay that money back though, because if you withdraw the application, it's like it's never happened. So you have to pay all that money back because you never technically filed, right? So that's one way you can change your mind and change the situation later. You can also suspend those benefits because in terms of Social Security benefits, if you're filing under your full retirement age, you're limited to the amount of money you can make. This year, it's $23,400. So anything over $23,400, Social Security holds back $1 for every $2 you go over. So if it turns out you're going to, not make that much because you lost your job or whatever the case may be, and then 2 or 3 months later you find a job and it's going to pay you a whole heck of a lot of more than that, you just call Social Security and say, hey, I'm going to make, $70,000 this year, and then they'll hold back $1 for every $2 you go over. And then essentially your benefits are suspended. You won't lose those months. How it works is that if you get your benefits, let's say 30 months early, but then after 10 months, you suspend your benefits because you found a job again. Once you hit your full retirement age, Social Security, the computer system, automatically looks at that and they say, hey, Bob is reduced by 30 months. But Bob only took 10 months worth of checks. He was suspended for the other 20 months. So they add those 20 months worth they unreduce it. They don't give you 20 checks for those months. What they do is from now on, you're only going to be reduced for 10 months, like you took your benefits 10 months early instead of 30 months early. So they readjust that. And one more thing about filing for retirement benefits, survivor benefits, spouse benefits, there is the annual earnings limit and the monthly earnings limit. Okay, so let's say your boss just notified you that you're going to lose your job in June. From January until May, let's say you made $40,000, and you're like, oh, I've already made over the annual earnings limit this year, so I can't start my benefits. That's wrong. That's wrong. What they can do is they can switch from what's called an annual earnings limit to a monthly limit. So even if I'll exaggerate here, if you made $1 billion from January until May, Social Security doesn't care. It's only when you start your benefits. So if you're going to start your Social Security benefits in June, they only care about how much you're going to make starting June and for the rest of the year. So they switch to what's called a monthly earnings limit. So instead of the 23,400, they say, okay, when is the first month you're going to go under $1,950 in earnings, gross earnings? And you'll say June. Okay, are you going to be under $1,950 for the rest of the year starting June? Yes. All right, we'll start your check in June. We don't care that you made $1 billion before you collect your Social Security benefits. So that's not an issue. So that's the important thing. Kind of those three things I want you, and please share this to anybody around you, that this is what we do here in a community. We learn, try to learn about this stuff for ourselves, but more importantly, or just as importantly, for all those people around you. So number one is the trick to try to get head in line if you really, really need those benefit amounts. And once you start your benefits, it's not written in stone. You can change those benefit amounts. And what you do before you start your benefits is not really relative. So those are the important things. In terms of Medicare, if the money is important, but Medicare is also extremely important. There's a lot of people that are going to lose their Medicare, or are going to lose their health insurance from work because they're losing their job. And it's important that you sign up for Medicare immediately, because if you got prescriptions and doctors that you need to see, you need to make sure, you're put ahead of the line. So for those two forms, if you really need that, if you lose your job towards the end of the month and you need your new Medicare and your prescription drug plan and everything to start the next month in January, on the first of that month, then you really need to take it down, because when you fax it into the system and everything, it gets into the system, that's fine, but it actually takes a human being on the other side to pull that paperwork down and process it. I would not wait for that to happen. I would go down to the local Social Security office, take those two forms down there, one that you fill out, one that your employer fills out to avoid that penalty, and say, hey, I need my medication. I just lost my health insurance. It's going to last to the end of the month. I need Medicare Part A, Part B, Part D, and whatever Medicare supplements or Medicare Advantage you get. I need all of that to begin on the first of next month. So here's the forms. Please put that in the system. And the person at the front window, the customer service representative at the front window, can immediately put that in there. You can watch them. It only takes them a couple of minutes to input those two forms into the system, and that'll notify Medicare, and they'll send out your Medicare number and all the rest of it. And if you really, really need help, if you need those prescriptions soon, you need to also sign up for a prescription drug plan and a Medicare supplement or Medicare Advantage or whatever the case may be. And you can reach out to my partners at Chapter, and they help y'all with all things Medicare, and they support the live Q&A, which we will start right now. Okay, let's get some questions here. Nona just heard about an Arizona family whose dad passed in February 2025, but Social Security misdated it to 2024, so took out all the 12 benefit months. After quite a while, it was all put back. Goes to show, keep your eye on your accounts. Yes, usually how that happens. Well, we don't usually, by my experience, I've done this a few million times. It's the funeral home that the funeral home or the coroner's office, wherever that county, when they generate the birth certificate or the death certificate, they put in the wrong date of the death. And that's unfortunately, that's how Social Security gets notified. When you see people that were incorrectly unalived, that's usually where it starts from. And Social Security has a policy of we don't have a comment. When that happens, public relations from Social Security says, we don't comment on those type of things, because it's a no-win situation. It's hard to tell where it came from. But anyway. All right, Deborah, my partner is 62 years old, working part-time, no full-time job in sight. Is it wise to apply for Social Security now? If he wants to wait for full retirement age to get those higher benefits, whatever the case may be, then that's a personal situation. But obviously he'll need other money to bide him over until that time. If you need the money, then get the money. So there's a lot of reasons to decide why you need to start when you need to start. And I'm working on my website. It should be done here pretty soon. And I've got a little thing that tells you about when to start benefits. It's about, obviously your health. You get more if you do 70. It's going to affect, other benefits in terms of survivor benefits. What about your genes? All these different questions. So hopefully um, the website here will be done hopefully this week. But as someone mentioned, websites are never done. So anyway, and it's going to come up with a calculator too, so you can figure out what type of break-even analysis, how much you're going to be losing or gaining based on filing those benefits early. So look for that to be live here very, very soon. Will it affect my live-in roommate's Social Security amount, Deborah? Okay, so this is your partner 62. Will that affect roommate's Social Security amount? The only time anything like that would affect other people in a household if those people are receiving SSI, which is the welfare-based program, supplemental security income. If they're receiving any other type of benefits, no, it does not affect them at all. My husband is on SSDI. I'm on Social Security. Can work for SCSP, Senior Community Service Employment Program, a federal funded program, without it affecting his disability benefits. We love it. Yeah, there are. My office that I ran, we brought in. It's called an ARP. It's a senior program like that. There are senior programs. It's sponsored by the Department of Labor. I'm not sure if they're going to have money anymore to sponsor that, but it's run by AARP, or the AARP. It's senior volunteers. Even though they say it's volunteers, they do pay you a stipend. There's also called non-paid work experience. If you're a veteran, you can go to the Veterans Administration and ask about NPWE, and even though that says non-paid work experience, the Veterans Administration pays veterans to kind of volunteer to government agencies. And in my office, we had more senior volunteers and veteran volunteers than all, I guarantee this is true, than all 1,200 plus offices combined. Because our office, we used more of these volunteers than any other office because, hey, it's like free volunteers. I'm not sure why the other offices never used them. I think it's just a matter of managers being lazy and not going through all the paperwork. But yes, yeah, it's a great program. Yeah, we had a lot of people through there, and a lot of the volunteers we actually hired. So, Learner International. What action can I take if I do not get a response from any of the functional Social Security offices? Because this has reached the level of, I need my money. Reach out to your politician. They're the ones that are responsible for you not getting your benefits. When you paid FICA taxes all those years, all those decades, you paid for those benefits, but you also paid for help getting those benefits, and you're not getting the help, and you paid for that help. It's like, hiring a plumber and then the plumber never shows up. You already paid for him. Well, you're going to be, irate, right? Well, this is the situation. And whose fault is that? It's the politicians. They refuse to support Social Security because a lot of them don't want Social Security to work because they want to break it so they can give it out to their billionaire buddies. So call them up and hold their feet to the fire and say, hey, how come, you aren't providing customer service that we need? These are our benefits. Why are you blocking us from our benefits? So my husband passed December 31st, 2024. I still haven't received my benefits. I really need it now. Same type of situation. This is unfortunately the same exact situation. Reach out to your politician and say, Kathy, that's completely unsatisfactory. You should contact your politician, have this turn into a congressional, or if you're able to go down to your local Social Security office before you go down there, reach out to your politician and make it a congressional. And then when you go down to local Social Security office and say, hey, here's what I need. By the way, my congressperson, my senator, my House representative, they will be contacting within the next 24, 48 hours. I just want to give you a heads up. They're going to reach out to you too. And that'll light a fire under everybody. But yeah, that's completely unsatisfactory. So, all right, let's see. I have Kay ask, I have Part B and on Medicaid, but it can't get Part A. Okay, so you, people like, that's impossible. No, it's not impossible. People can have Medicaid and Part B, but not Part A. And you're like, how can they get Part B if, the Part A is zero premium? Well, if you pay your 40 quarters, then you can get Part A for free for zero premium. But if you don't, you can't. And they're like, but how'd they get Part B? Well, in Kay's situation, probably Medicaid is paying for Part B. And you could actually contact Medicaid and see if they're willing to pay for Part A, but that's several $100s more than Part B. But you can reach out to Medicaid and say, hey, you're already paying Part B, because why would states do that? Because they're already paying for your health care. So let's say, for instance, they're paying $5,000 a month for your health care. And why did they sign you up from Part B and they're paying for your Part B? Because it's cheaper to pay $185 and move a lot of those costs over to the federal government. So they're like, okay, if we pay K's $185 Part B premium every month, we're actually saving $2,000. And then if K goes to the hospital, then we're not saving anything because we have to pay all of that. But they might say, okay, in your case, maybe we should pay for your hospital too. So, and then if you get Part A and Part B and you're on Medicaid and Medicare, you're also eligible for those Medicare Advantage dual eligible plans. I always recommend Medicare supplement plans, looking at those first. But in terms of if you receive Medicaid, you can't get a Medicare supplement plan. So I would definitely check out a Medicare Advantage dual eligible plan. That's the one with all the extra benefits. It could have extra benefits depending on what's available in your area, and you can reach out to chapter there and they can see what's available in your area. So John, great perspectives, Dr. Ed. Thank you. Appreciate it. Much appreciated. I was WEP, now getting 50% of my X. No more GPO. Lump payment showed July 2024 through November 24. I thought retro payments from January, 12 months. Yeah, according to the law, HR 82, the Social Security Fairness Act, it's supposed to be retro all the way back to January 2024. So if you were actually well, in your case, your GPO, government pension offset. So if your benefits were GPO'd effective January 24, then they should un-GPO them. So at least you got your start. And when you get the letter, if you haven't got the letter, or you probably already got the letter, it says, hey, here's the deal. Here's what we did. Here's how much you're going to get from now on, yada, 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 yada. If you disagree with this decision, here's what you do. So what you do is you file an SSA 561 and request a reconsideration and say, hey, thanks for the money, but I'm missing, 5 or 6 months. So Penelope. Oh, Penelope is here again. Yeah, we haven't seen Penelope in a while. Where have you been, Penelope? Hopefully everything's okay. Carol, am I eligible to receive benefits from my deceased husband's Social Security? If you were, deceased husband, so it sounds like you were married possibly when he passed away. If you were married when he passed away, you had to be married at least 9 months. If it was a divorce type situation, you had to be married 10 years. And so that's, the time requirements. And then in terms of survivor benefits, if you're at least 60 years old, you've jumped over the other hoop. And then whether you're receiving benefits already on your own record. So if there's more money on the surviving spouse benefits, then you can get onto those, and then don't touch your own. Let your own continue to accumulate all the way until you hit your full retirement age or 70 or whatever the case may be. So yeah, it's if you fulfill those time requirements, the next thing to see is if there's any more money. So I would reach out to Social Security, give them that information, your husband's name, Social Security number if you got it. If you don't, no big deal. Just give them the how old the person is, where they were born, and they will be able to find it. So. Hello, are there any new changes being made? Do we have to go online to collect our Social Security checks now? Okay, yeah, that's more internet myths out there. Well, actually, it wasn't. It was Doge didn't really know what they were doing. And they said, okay, everybody has to do this. And then a few days later, they said, okay, not everybody has to do this. Only these people have to do this. And then they changed it again and say, oh, okay, well, actually, nobody has to do this anymore. So they don't really know what they're doing up there. As of right now, no, you do not need to go online. They're putting out terrible messages. The misunderstanding here is they are saying if you want to go online and change your direct deposit or your address or download a 1099 or whatever you want to do, you have to go into the new system. And what's been around for about a year or two, that new system. If you set up your My Social Security account 3 or 4 years ago, you can't get into the system anymore. Based on that old information, the old login ID. You need to go into the new system. It's a safer system that's been around for about a year or so. But if you don't want to go online and do stuff online, you're good. You don't need to do anything. The only time you need to go in there and register under the new system is if you actually want to use online services. But if you don't, more power to you. Doesn't affect your benefits at all. So yeah, a lot of people are freaking out about that. Are my benefits going to stop? And there's another thing that was it Christy Nome, the head of Department of Homeland Security, came out there and did a public service commercial, whatever, and said if you don't have a real ID, you can't get on a plane and you can't get into federal offices. Okay, that's incorrect. In terms of Social Security, as of right now, May 5th, 3:31 p.m. West Coast time. Again, DOGE is changing these policies on a daily, minute-by-minute basis, it seems like. But as of right now, you do not need a real ID to go into the Social Security offices. Even though they're federal facilities, you do not need a real ID to go into them. So if they stop you from going in there, then they're 100% wrong. So could you imagine that? All the people that lost their ID need to go in there and get start the whole ID process again. People that need their checks and can't get, that would be crazy. Yeah. 94 days after the death of my husband, I received my benefits for Kathy. Yeah, wow, 3 months. That's completely unacceptable. I've taken hundreds of thousands of survivor claims and people come in and they provide the proofs and, the deaths that already been proven. I, checked the marriage certificate, yada, yada, yada. And before they walk out of the building, case is adjudicated. If they're entitled to benefits, check goes in, direct deposit the next day. This completely unsatisfactory. So reach out to your politicians and tell them this is completely unsatisfactory. So, I don't think for all the new people watching, I've got a lot of possibly some new people here. I forgot to throw that up and that way you know who I am. So, all right, let's see. Received an email from Social Security saying need to create an account, which I do have one. Found it weird. Yeah. So, but it might be because you set up one of the old accounts a few years ago. And if you have the old account, you need to set up a new account. But if you've already set up a new account, then just ignore it. So, but there might be some type of scammers out there that are sending you emails and whatever that says you need to set up a new Social Security account and it gives you a link. Don't press the link. Yeah, don't press the link. If it says you need to set up a new Social Security account and you're like, I already got one, ignore it. Or if you say, I've been meaning to do that, throw that email away, go to SSA.gov and do it through there. And that way you can be sure you're not pressing some weird link. Social Security said my late husband not qualified for the Fairness Act because he worked for the state without FICA for 8 years, but they forgave him for that because he worked elsewhere 20 years before. Is this accurate? No. Well, it depends on how much. Technically, you have to work 30 years. 30 years substantial earnings. The 20 years, if you would have said 30 years before, then I would have said, yes, that's accurate. But the 20 years, no. I don't. If he didn't pay into Social Security and his benefit amount was wept, if his benefit amount is PIA, his primary insurance amount, was recalculated based on his non-covered pension, and he told them about a non-covered pension, and they, got the what it's called, the WEP letter and everything, and they did the calculations, and his benefits were recalculated based on that. The 20 years, it makes some difference, but not all the difference. It should be 30 years. So I would double check on that one. I would definitely check on that one. The MAGA Republican mega bill has severe Medicaid cuts in it. SNAP also will get huge cuts. These people are forcing to pay price for this. Yeah, I mean, the only way you can cut $880 billion out of that area of the federal budget is going through Medicaid. And is there fraud, waste, and abuse at Medicaid that needs to be addressed? Of course. But I compare it to like having a kid that eats too much junk food. It's like, okay, I really need to make my kids stop eating so much junk food. So how can I do that? Oh, I'll just cut all food. I'll just cut all food by half. I'll give him only half the amount of food. So that'll reduce his junk food part. It's like, well, he's also going to starve to death, and Child Protective Services is going to come visit you. But that's what they're doing with Medicaid. That's what they're talking about doing with Medicaid, and it hasn't happened yet. And it won't happen if y'all reach out and say, hey, yeah, go after fraud, waste, and abuse, but don't, starve the kid in the meantime, because it's going to have, collateral damage, we used to say in the Marine Corps, right? And it's going to have other issues as well. So people will lose Medicaid. And as we talked about with this other person, Medicaid pays for Part B of Medicare for a lot of people. So they will lose Medicaid, so they'll have to pay a lot more for their health insurance and deductibles and co-insurance and all that kind of stuff. Plus, they'll also have to pay the $185, which is going to put it even worse situation. And if those people are receiving a Medicare Advantage dual eligible plan, some of those people will receive those grocery cards. They do exist with $100, $200, $300, transportation, yada, 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 that they really need to get by on a monthly basis. They're going to lose that because they no longer have Medicaid. And because of all of that, they might just say, hey, forget about it. I can't afford the $185. So I'm just going to cancel Medicare Part B. And I'll just go without health insurance. And my primary care physician will be the emergency room, like it used to be in the old days. So a lot of phonies people on the Facebook, Instagram, X, and YouTube channel doesn't know nothing about SSI, Social Security. Yes, that's unfortunately where I spend probably 30, 40% of my time saying, oh my gosh, I found another BS or person out there that, said this, that, the other, and it's not true. So, yeah. Monica, thank you to be so informative. Listening to you make my day. I appreciate it. You have educated me so much. Keep up the good work. All right, Monica, thank you. And I know you're using that information to help those people around you. One of these days, someone is going to come up. I don't think I got time to do it, but if someone wants to come up with little things that ask me about Social Security, little buttons or things like that, we'll put it on the website. And and that way, if you're walking in, some Walmart or something like that, and you see the ask me about Medicare, but if it says ask me about Social Security, then you'll say, oh yeah, I know about Social Security, and you can go ask Ed on the live Q&A. So yeah, a lot of people need help out there. So let's do what we can do. I was income reduced. I was living with my ex. I've been on my own 2 months in my own home. I've updated address. Can I go in, turn in proof of address? Do I wait for income increase if approved? Okay, so you're receiving SSI. It sounds like, because this is called a living arrangement change. Yes, anytime when you're receiving SSI, supplemental security income, anytime you change your address like that and your rent increases or decreases or something like that, they will adjust your SSI. And remember, the max you can get on SSI this year is $967. But yes, anytime you have a living arrangement change like that, you definitely need to notify Social Security. So let me see. Okay, I already answered that one. Hello, are new changes being made? Do we have to go online to collect our social? Okay, so I already answered that one. So do I need to do anything once I get approved from Social Security Disability to get Medicare? No. When you are approved for SSDI, supplemental or Social Security Disability Insurance, you automatically get Medicare Part A and Part B after being on disability for 2 years. But be careful, because if you've been waiting 2 years to get your disability claim approved and they finally approved it yesterday, guess what? You're eligible for Medicare today. So you don't have to be, when your Medicare, when your disability started. So if they give you 2 years of back pay, then guess what? A Medicare card is in the mail. So if you did it a year ago, then so I would reach out to Social Security and say, hey, by the way, when is my Medicare actually going to start? When is the 25th month that when my Medicare will start? Because a couple of 3 months before then you have to prepare. Because original Medicare is awesome, Part A, Part B, but there's 6 gaps in there. There's a lot of financial liability. So you need to fill those gaps. You can do either a Medicare supplement plan, or which are the ones I recommend, a Plan N or a Plan G, or a Medicare Advantage plan. But if you're on disability, probably in your state and most states, you can't get a Medicare supplement plan. So you'll have to go to a Medicare Advantage plan, which is fine. You just have to check. It takes more effort. And then when you turn 65, you probably can get a Medicare supplement plan, or you definitely can get a Medicare supplement plan. They can't deny you for pre-existing conditions or anything like that. So, okay, I already answered that one. Will we receive our full regular monthly Social Security checks? No new threats to cancel or hold out payments. As of right now, nope, unless the only thing that could happen, because DOJ doesn't have that authority, only Congress can reduce your benefit amount or increase your benefit amount. The only thing that can happen is they mess up the computer system. And Social Security has been begging Congress for decades, we need to update the Social Security system, and Congress has refused for decades. And now it's being held by bubblegum and string. And the people that were keeping it together with bubblegum and string were essentially let go, told to leave the premises. So now we've got a bunch of people that don't know. Yeah, so the system has gone down. Not the internal system. Well, the internal system has, but it hasn't stopped checks yet. So bar that, you're good for now. But remember, the checks will be reduced. Everybody's check will be reduced in a few years because of the Social Security trust funds, depleted. We've known about this coming for decades, and we haven't done anything about it for decades. And, I guess better late than never. We definitely need to take action on this. So reach out to your politicians and ask them, what are you doing to make sure we don't get those cuts in the future? And don't let them tell you all those BS stories about the Social Security, trust fund was stolen or given to illegals. That's all BS. It's just they're just trying to distract you. I have a question from Texas. I applied for my turn from survivor's benefits. Everything is done over the phone, except in the office needs to copy of my marriage license. Do I have to wait 1 or 3 hours? Yeah, unfortunately, that's the par for the course. You can actually mail your marriage certificate in, not your marriage license. Your license, that doesn't help, because your marriage license just I'm sure you just mistyped this, but people send in their marriage license sometime, and the marriage license doesn't work because that's just the license you receive to get married. So maybe one of you had cold feet and you decided to run. So you never actually got married. So you actually need the marriage certificate, not the marriage license, but the marriage certificate that you actually went through with it. But yeah, unfortunately, you have to, yeah. Unless you go to McKinney, Texas. If you're in McKinney, tell Patrick to put you in front of the line. Yeah. But he's probably in there helping 2,000 people out a day. He's the hardest working guy in Social Security. So Patrick in McKinney, Texas. So FYI. Patty, my husband and I divorced a few years ago. I'm 67 and he just turned 63 this year. Am I eligible for his Social Security? He still works. Yes. So this, even though he hasn't received benefits, you could have filed for benefits on his record when he turned 62 years old, as long as you were divorced 2 years at that time. So it's called independently entitled divorced spouse. He does not need to be receiving his benefits. He just needs to be eligible. So at least 62. Even if he hasn't filed, that's fine. So yeah, you could have received once you started your benefits, you were eligible for benefits on his record as long as he was 62. But yes, in terms of the timing, yes, but in terms of your benefit amount has to be less than half of his. If your benefit amount is less than half of his, then you will be eligible for benefits on his record. So if you don't know whether his benefit amount is that amount, then you just call Social Security, give them that information. They'll look at it real quick and they'll say, oh yeah, you're definitely entitled to more benefits. Let's set you up with an appointment. But be careful on this. There's a lot of people out there that are walking around losing money because let's say, Patty, you call up and you give them your ex's information and they look and they say, no, you're not eligible for benefits. And you say, okay, I'm not eligible for benefits. I thought I was, but I guess I'm not. And then 10 years later, you're eligible for benefits. And you're like, wow, wait a second, what happened? Maybe between now and then that person passes away. Because spouse benefits, your benefits have to be less than half. But surviving spouse benefits, you get up to 100%. So if his benefit amount is $1 more, then you're entitled to those benefits. So there's a lot of people out there walking around. So reach out to people and, say, hey, aren't you entitled to spouse benefits? Weren't you married to someone for at least 10 years, yada, 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 or, married to someone for at least 9 months and they passed away? How come I was told 10 years ago that, I wasn't eligible. Was it because the calculations were different at that time? Let's call them again and let's see if that's still the case. And yes, you will have to wait on the line for hours. So, Carol with a K. When I first called for Social Security disability, they told me I was eligible for spouse benefits, but 5 months later gave me disability, so I'm at reduced rates, never informing to freeze mine. Reduced rates. Eligible. So for disability benefits on your own record, if you're getting disability benefits on your own record, that's not reduced. If you are receiving spouse's benefits, if you file for those spouse benefits before your full retirement age, yes, they will be reduced. But maybe, you'd have to look at the numbers. Did you file for disabled widows benefits? Did you file for disability on his record? So there's a lot of variables there. But if you disagree with that decision, again, you can file that 561, and I probably need a lot more information to figure out what we're looking at here. Will a car accident settlement stop my disability payments from Social Security? No. The only time anything like that would affect your Social Security is if it wasn't Social Security, it was SSI. SSI is not really technically Social Security. It's Supplemental Security Income, a welfare-based program that Social Security administers. But if you're receiving SSDI, then no, doesn't affect it at all. But if you're receiving Medicare, it might affect your Medicare. So here's a lot of people get wrong and they get in trouble. This goes with any health insurance. If you have any health insurance and you get into some type of accident or, fall or whatever the case may be, and then you go to your health insurance company and let's say you need a $20,000 operation. You get that $20,000 operation, your health insurance company pays for it or Medicare pays for it or whoever pays for it, right? And then later on, you get a settlement for $1 billion, and part of that $1 billion is to pay for your medical. So they essentially paid you $20,000 to get that medical, that surgery. And then the health insurance companies are going to say, hey, give us our $20,000. And you're like, well, no, that was paid to me. No, but we paid for your surgery and then you were reimbursed for your surgery. So that's our money technically. So they will come after you. There are entire armies of lawyers out there. That's their entire practice, is to do that, is to get that money back for people. So Let's see. TT, my spouse coverage from my employer will stop 6/22. When should he apply for Medicare Part B? Beginning of June or July with 1 week gap? I get it now. We'll start the process now. So if you're looking, if he's past 65 years old, his Medicare, his health insurance from work is going to stop in June. So usually they go for the entire month. So it's probably going to stop at the end of June. So he's not going to have health insurance starting July 1st. So I would start the whole process now. If he's after 65, then to avoid that penalty, get two forms, a 40B, and you can just Google this one. When I have my website up, you'll have the links to it, but with instructions, but almost. But you just Google, do a 40B and a 564. And the 564, you take down to his employer. An employer fills it out and says, yes, 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 he had health insurance from current work since he turned 65. Don't penalize him. And then submit that to Social Security. And then on the form, on the 40B, write start Part B or Part A, Part B, or both starting July 1st. Okay. And then you can reach out to Chapter there and they can help you, find a Medicare supplement plan or Medicare Advantage, Part D, prescription drug, and all the rest of it. They can help you with all the rest of it. I was penalized $330 a month when I applied for Part B it was cut off. So yeah, there's a couple of ways you'd be penalized for Part B. One is an actual penalty, and that's because you didn't sign up at 65 and you didn't have creditable coverage. So if that's the case, you'd have to pay 10% penalty for every 12 months you did not have Part B. So yeah, that means you were 10 years late if it's $330. Probably what the penalty is not a penalty. Well, I guess you can call it a penalty. It's called IRMA, Income Related Monthly Adjustment Amount. It's for higher wage earners. It's an extra Part B premium that they pay based on your earnings from 2 years prior. And if something has changed, you have what's called a life-changing event since 2 years ago, then you can request an appeal and get that taken out. So, cute girl asks, every time I see you, I want to ask you a question, but I don't know where to start. Okay, well, there you go. Let's see. And let me see if she actually asked a question here. All right. Lefty asks, husband 63 drawing Social Security this year. I'm 60 still working. Does the limit apply to both our dollar? No, it does not. So if your husband started Social Security this year, it's only based on his work. So if you're making $1 billion, doesn't affect his Social Security benefits at all. So he just has, because he's 63 years old collecting Social Security benefits, he just has to limit his income to $23,400 a year. Anything over that, Social Security will hold back $1 for every $2 you go over. So Dargar asks, is there a better types of Medicare Advantage? Like, can you pay more for better coverage? Say $185 plus for extra for better advantage. You have to pay the $185 regardless. So if you have a Medicare supplement or a Part D or a Medicare Advantage plan, you have to pay the $185 unless you're getting someone else Medicaid or something to pay for it for you. But in terms of Medicare Advantage, it really depends on what's available in your area. There are probably dozens of companies in your area. There are probably 50, 60, 100 different plans in your area. And sometimes, some of them, the Medicare Advantage really depends on what's available in your area, and it changes every year. But sometimes, there are plans that, a lot of them are zero premium per month, but there are some that cost more. But it really depends. I've seen it both ways. I've seen it where people, you can get some extra coverage if you pay more. And then other areas and other years where it's like, no, the best one for you is zero premium. So I wouldn't necessarily look for one. I would, you go down the list and you look for your providers and you see whichever Medicare Advantage out of the hundreds in your particular area, which one covers the most of your providers. And then you look at your prescriptions, and then you look at all the other bells and whistles, grocery cards or transportation or gym membership or dental, vision, and hearing and stuff. And then you narrow that down to, the top 2 or 3 or 4 or 5. And then you look at all the numbers there and say, okay, well, this one, if I go to the hospital, I have to pay $50 a night. If this one's $100 a night, whatever the case may be. And then that's, and yeah, unfortunately with Medicare Advantage, because those plans are only good for 1 year, whatever plan you have, it's gone December 31st. It might be the same-ish starting January 1st, but often it isn't. So, but health insurance companies don't want you to check because they slowly degrade your plan, and you don't know it until you know it, until you actually get sick and say, hey, wait a second. When I signed up for this plan 3 years ago, you said I only had to pay $50 a night if I went to a doctor or a hospital, or $35 for a specialist. And now I have to pay $400 for a hospital, or $100 for a specialist. I didn't change my plan. Yes, you did. You changed it 3 times, or they changed it on you. You just didn't check. So yeah, insurance companies don't want you to check, but we're smarter than that. So the next time, unless you move or something like that, you have a special enrollment period, you can't really change a Medicare Advantage plan right now. The next time is in October. But there are a lot of exceptions. You can reach out to Chapter or whoever, and you can see if you can switch now or set up an appointment to switch to review to see if you need to switch in October. If you have a Medicare supplement plan, the Medigap, a plan N or G or F, you might be able to change. Well, people can change 365 days of the year, but they might have to go through health underwriting. Depends on your state. So if you have like a G and you're looking to save some money and get a cheaper G, because they're all the same, it's all price. The only thing different is price. So you're like, hey, I'm getting a G, but it's getting kind of expensive. I want to switch to a cheaper G. Then you can do that as long as you pass the health underwriting if you need to. It depends on your state. So Judy Mancini, great last name. I filed online for my benefits at my full retirement age. I received an email that told me they received it. Then an email wanted me to call and review my earnings. I did, had to leave a message. Should I call again? Unless when you left your message, you said, oh yeah, I've checked my earnings record and it's all good. So what they're doing is the person on the other side, the person, the claim specialist in charge of your claim is doing the right thing. Awesome. So kudos on them. Is they looked at your earnings record and they saw something that didn't look right. So like in 2002, 2003, there were a couple of 0 years, and they're like, oh, this person worked, consistently for years and years and years. But in 2001, 2002, there's no earnings there. Wow. Let's make sure this is correct. So they reached out to you. But if you looked at your earnings record and said, oh yeah, in 2001 and 2002, I traveled the world and, took the Euro train and, whatever. And you just call them up and say, yeah, if you're calling about my earnings record, I'm calling again. And this is my name. This is my social security number. And yes, I looked at my earnings record. I know there's a gap in 2001 and 2002. I was traveling around or, finding myself or whatever the case may be. And they'll go ahead and push the button if they don't have any other questions. Question, have you ever heard of the $255 death benefit taking 30 to 60 days? The 60 days is up tomorrow. I had to reapply due to my bank rejecting my first deposit. That only took 2 days. You don't have to reapply again. Yeah, that's probably why it's getting messed up, because you shouldn't have to reapply again. If the deposit was made, even if it was made to the wrong account, that means the lump sum death payment was processed. It's done. So when you applied again, it might have messed everything up. So again, it depends what you mean by reapply. But if you reapplied for lump sum, if it's already done, it's going to mess everything up. The computer actually shouldn't allow you to reapply because you already applied. So if the first direct deposit was, rejected by your bank because it was, wrong account number or whatever the case may be, then you just call up Social Security and say, oh, okay, yeah. The account number was, 12, not 21. And then the money goes back in there again. You don't have to reapply. But no, it doesn't usually take 30 to 60 days. But if you actually did reapply, yeah. So there's that. Cyber Susie. Hi, Dr. Weir. I'm new. Hello. Welcome. I'm so happy to find you. If I applied for disability and then suddenly qualified for survivors and began receiving it, can I get disability benefits also if I qualify? Can I get Medicare? Okay, good question. Yes, cyber. This is a common question that a lot of people out there are losing money because they do the wrong thing in this case. So if you're receiving disability benefits on your own record, you can 100% get other benefits. You can get survivor benefits starting at 60 years old. You can get spouse benefits starting at 62. You can get divorce spouse benefits starting at 62. And it does not affect your disability benefits on your own record. And the big question is, people say, okay, all right, so I don't care if I get disability, but if I get survivor benefits, I get, $300 more. So, I'll get survivor benefits instead of disability. But then people say, well, but if I'm getting survivor benefits and I'm only 60 years old, I'll lose my Medicare because I'm no longer receiving disability. That is 100% incorrect. Okay. What will happen is you get your disability and then you get survivor benefits or spouse benefits or divorce spouse benefits on top of it. One offsets the other. So you don't get two checks. You technically get two, but one offsets the other. But because underneath you still have disability benefits, your Medicare will continue. So your Medicare will continue. You'll just get extra money. But there's so many people out there. So press like and subscribe. Yeah. So many people out there that are eligible for more benefits, but they're scared to get those extra benefits, that extra money, because they think it's going to stop their Medicare, and it ain't. So, Johnny, notice of disability cessation received. Now what do we do? EPE ended 5/22, just notified recently with the overpayment due to exceeding SGA after 5-year work period. Yeah, so you had a medical CDR or work CDR where they reviewed everything and they determined you've used your trial work period, you had your extended period of eligibility, and then every month you worked above SGA, you weren't entitled to benefits for that particular month. So number one is Social Security. These are, the going back all those years and doing all that stuff and EPE and SGA and, all that stuff it takes a lot. And Social Security employees, they just don't have any Social Security employees to spend time doing things right. And unfortunately, so a lot of people are getting messed up, and that's politicians. That's what they want, to get you all to hate Social Security. All right. So, you review this and you call Social Security and you find out, when your EP started, and if you already know your trial work period and all that stuff. And then if you disagree with the calculations, I would start at that. If you disagree with the calculations, if you think they're 100% wrong or 50% wrong or whatever the case may be, you let Social Security know. You file a request for reconsideration. It's a SSA 561. On the 561, there's only a couple of lines on the form to fill out. So you just type, or you just write "see attached," and then you add a piece of paper that says, hey, here's my calculations. And then somebody else at the Social Security office will double check everything. And if it turns out you're right, then it's a beautiful thing. If not, then you can request a hearing with the administrative law judge. And they usually have a lot more latitude in addressing things like that. So, all right, we are over an hour. We always like to keep this down to an hour. Dave, thank you for the $20. Thank you very much. We appreciate it. My son and I definitely appreciate it. You are too awesome. And we got Connie, coffee, $10. Thank you very much. Thank you for the support. Wow, we're getting 99 from Tweety Bird. Oh, Tweety Bird's awesome. She's always here helping, answering questions and everything. You guys are awesome. And Kathy became a gold member. So you guys are awesome. We appreciate this. This is me and my son doing this. Obviously, we've got Chapter that helps out, and they sponsor this live Q&A. But yeah, the website is coming soon. So hopefully that's going to help a lot of people. All right, y'all take care. Have a beautiful, beautiful night. And please, please, please take care of each other.